Okay, so we have a chicken wing partially skinned. We have the upper wing segment and the lower wing segment that with the skin mostly removed. So again, here's the upper wing segment, lower wing, and then here's the wing tip. Okay, so I'm just going to go through this list with you here and the items on the lab sheet so that you can see what they look like. So obviously the skin is here where it's still intact on the wing tip. The fat is kind of this yellowish gelatinous substance that's soft. We have the muscle itself, which is kind of a pink color and firm, fleshy feel to it. The tendon, in order to find a tendon, you want to follow a muscle. The epimysium is here. You can see it's a little bit shiny, as opposed to the muscle tissue itself, which is underneath it. You can see how fragile it is. It's easy just to rip and pull apart. So here's the epimysium coating. But the tendon, you follow the epimysium up, and then here's the tendon. So it's this kind of rubber band-like structure here. So it's thin and kind of a white color. A ligament you would find up near, this is the humerus, the head of the humerus bone. And the ligament is this very tough cord-like, let me feel better with my gloves. This is one right here. So it's this tough white cord that's been cut here, and it used to, here's another one, this is a really good example right here, and it's been cut that it used to attach the humerus to the scapula. Okay, and the last thing is cartilage, which you can cut very easily with a scalpel. You can cut a piece of it off. And now you can see here's the bone itself with some of that spongy blood tissue, and here's the softer cartilage, so it's hard rubber consistency protecting the bone. And this is what happens during arthritis. It gets kind of worn away. All right, so the next thing I want to show you is, in order to figure out which wing it is, whether it's left or right, it curves towards the opposite way. So if you look at this and your chicken is, rest of the body is here, and the wing is going to come up and around, this would be a left wing because, again, it's curved towards the opposite. Okay, the joints, this is similar, this is a ball and socket up here, so similar to our ball and socket connecting the humerus and the scapula. This is kind of the elbow down here, where we have the humerus, we have the ulna and the radius all articulating here. And then we have this similar to our wrist. So here we have the ulna, the radius, and the carpometacarpus, which is a fused bone that's a little bit different. If you look on the diagram, it's over here. So here's the ulna, the radius, and then the carpometacarpus, this looped bone here articulating. Okay, so those are the joints. So we have ball and socket, we have hinge, and this is actually another hinge joint up here in the wrist of the chicken wing. Okay, the last thing I want to show you is how you can make the muscles kind of contract and move. So if I immobilize the humerus, the ball and socket joint, and I have the elbow in the flexed position, I can take my tweezer and contract a flexor. Flexor means that you're decreasing an angle at a joint, and extension means you're increasing an angle at a joint. So right now the elbow's in the in the extended position. So I'm going to contract a flexor, and you can see that I've now flexed the elbow. Okay, closing that angle. Okay, so this then must be a flexor muscle. Okay, now if I put the elbow in the flexed position and I pull back on this muscle, you can see now I've extended the elbow. So this then must be the extensor muscle of the elbow. Okay, if I immobilize the elbow joint, and you can see now that the wrist is in the flex position, and I pull on this muscle, you can see that now I've extended the wrist with that, okay? Pulling on this. So this must be an extensor of the wrist. If I extend the wrist, and now I pull on this muscle, you can see that I'm now flexing the wrist, pulling back, okay, closing it. This joint offers a little bit less flexibility than the one at the elbow, and that's just an adaptation for flight. So again, flexor of the wrist, and then extensor of the wrist. Okay, so you can see a little bit how these muscles move. At this joint, just make sure that if you're describing the elbow, that you tell me which bones are articulating there. And at this joint, you describe the joint by describing again what bones articulate there. Okay? So that's pretty much it.